Today, we're going to dig into one of India's biggest government programs. But don't worry, we're not getting lost in dense policy papers. Nope. Instead, we're going to see it in action through the story of just one hospital and one very, very big number. So let's start with just this number, 118,041. What do you think that is? It's not the population of a town, it's the number of people who got critical, often life-saving treatment thanks to this program at just one single hospital since 2019. That number alone tells a huge story. So let's unpack it.
To really get what that number means, we first need to zoom out a bit. This whole story is rooted in India's massive health safety net.
At the heart of it all is the Ayushman Bharat PMJAY scheme. Now, that's a mouthful, I know, but you can just think of it as a government-funded health insurance card. It gives families a safety net of 5 lakh rupees, which is about $6,000 every single year for serious hospital stays. We're talking about the kind of care that can otherwise wipe out a family's savings. The whole point is to stop a health crisis from becoming a financial disaster.
And the scale here, it is just mind-blowing. The goal is to cover over 12 crore families. Let that sink in. That's about 500 million people. This makes it, by far, the largest government health insurance program on the entire planet.
Okay, so with that massive national picture in our heads, let's zoom right back into where our story started. We're going to focus on one absolutely critical medical hub in North India.
We're talking about PGI Chandigarh, the Postgraduate Institute of Medical Education and Research. Now, this isn't just any hospital. It's a tertiary care institute. What that basically means is it's the top-tier facility where the most complex and serious cases from all over the region end up. For millions, this place is a genuine lifeline.
And get this, look at the financial side of things. Since the PMJA scheme kicked off, this one hospital, has processed claims worth over 233 crore rupees. That's almost $30 million. It's a huge amount of healthcare, all paid for by this program at just one single location.
And this is where the data starts to get really, really interesting. Because when you break down who these patients are and where they're coming from, a very clear pattern starts to emerge. So the natural question is, right, out of all the different states that PGI serves, whose residents are using this health lifeline the most? Well, the answer could not be clearer. The data is just overwhelming. Look at this, almost half. A staggering 47% of all PMJAY patients at PGI are from the state of Punjab. That's more than double the next state, Haryana. It's not even a close race. And this bar chart really hammers the point home. Just look at the bar for Punjab, over 55,000 patients. Now compare that to Haryana at 24,000 and Himachal Pradesh at just under 17,000. It's not even in the same ballpark. So, we have the what? Punjab is the clear leader here. But now we need to figure out the why. What's really going on? It's the logical next question, isn't it? Is it just that Punjab has more people? Is it just closer to Chandigarh? Or is there something else happening? Why this one state by such a huge margin? Well, according to the experts at PGI, it's really a mix of 3 key things. First, and this is the tough part, Punjab unfortunately has a higher incidence of certain serious diseases, like cancer, that need the advanced care only PGI can offer. Second, the state has a really well-established referral system. Doctors there are great at spotting these cases and sending them to the right place. And third, well, it's just simple geography. For many people in Punjab, Chandigarh is the closest major medical center. And for all of you who love the raw data, this table lays it all out. You can see the patient numbers we just talked about, and right next to them, the amount of money claimed. And look at Punjab again, over 108 crore rupees. You can see a direct line from having more patients to more high-cost care being funded by the program. But you know, after looking at all these numbers and all these charts, it's so important to step back and remember what's really happening here. This isn't just data on a slide, it's about people's lives. And this quote from Dr. Ripin Koshal, he's the official who oversees the program at PGI, it just sums it all up perfectly. He calls the scheme a boon for the poor and needy patients. And that's it, right? That's the perfect reminder that behind every single one of those 118,000 numbers is a person, a family, who got the medical care they needed without the fear of it destroying them financially. So what's the big takeaway here? By zooming in on the data from just one hospital, we've actually gotten a glimpse into the story of an entire region's health. This isn't just a bunch of statistics, it's a map.
It's a map that shows where a massive national program is meeting a critical need right on the ground. It tells policymakers where resources are needed most, and it proves that sometimes the most powerful stories aren't in the big national reports, but hidden in the details of a single place.